Hi, everyone. This is Podcast for Patients with the Aplastic Anemia and MDS International Foundation. My name is Lee Clark, Director of Patient Services, and I'll be moderating the podcast today. Our podcast series is brought to you with thanks to our generous support from patients, families, and caregivers like you, and our generous corporate sponsors. I'd like to thank everyone for supporting the podcast series. Today, we're going to be talking about blood clots and PNH with Dr. Max Norkin, who is a hematologist oncologist with Baptist MD Anderson Cancer Center located in Jacksonville, Florida. Welcome, Dr. Norkin.
Thank you for having me.
Thank you so much. So, what is a blood clot?
One of the most frequent and feared complications of PNH is formation of blood clots. And in patients with PNH, without treatment, blood clots are frequent, could be quite extensive. It can develop in unusual places and can often be life-threatening. So blood clots are gel-like collections of blood that form in your veins and arteries when blood changes from liquid to partially solid form. Blood clotting is also called coagulation. Is an important process that under normal conditions prevents excessive bleeding after an injury of a blood vessel. So that's a good thing, but unfortunately it can be abnormal. And in normal conditions, body naturally dissolves the clot after injury has healed. However, blood clots can form inside the vessels without an obvious injury, and that's abnormal situation. So in this situation can be quite dangerous and require accurate and timely diagnosis and appropriate treatment.
Thank you. What are the signs and symptoms of a blood clot?
Yeah, the signs and symptoms can vary quite dramatically depending on where the blood clot has developed. Abnormal blood clotting can occur commonly in veins and less frequently in arteries. And abnormal blood clots that can develop in the vein may restrict the return of the blood to the heart and can often cause pain and swelling. So pain and swelling, the most common signs of the blood clot, and typically happen in the leg, less frequently happen in the arm. Worst case scenario, the blood clot can detach from the point of origin and travel through the vessels to the lungs and can block the blood supply to the lungs and can add some pressure to the heart. This is a very dangerous condition and can be quite life-threatening, and it's called pulmonary embolism, or PE. In this situation, symptoms include shortness of breath, chest pain, and this is a medical emergency and requires urgent therapy because it's life-threatening. Interestingly, so in patients with PNH, blood clots can often develop in unusual places, including liver. It's called Budd-Chiari syndrome, and it's associated with jaundice, abdominal pain, enlarged liver, and fluid accumulation in the abdomen. Sometimes thrombosis in patients with PNH can happen in veins that's in the abdomen, in the belly, and it can lead to bowel infarction and may require surgery. Blood clots in the vein around the brain can happen, and not frequently, but can happen, and it can lead to headaches and some brain swelling. And sometimes blood clots can happen in blood vessels of the skin, can cause painful rash and bruising.
Thank you. Why are PNH patients so susceptible to developing blood clots?
Yeah, PNH is a condition in which uncontrolled complement activity leads to excessive breakage of the red cells. That's called hemolysis, inflammation within the lining of the blood vessels, and platelet activation. So all of these three things significantly increase chance for abnormal blood clot formation. And that's why the patients with PNH are very prone to develop blood clots, sometimes very extensive blood clots, and blood clots in unusual platelet. It was shown that development of blood clots is associated with inferior prognosis in the patients with PNH. Before the introduction of complement inhibitors such as Soliris or eculizumab, Blood clots happened in up to 30 to 45% of all PNH patients. So almost half of the patients with PNH had a history of blood clots before the novel treatments were introduced. Luckily, with new treatments now, we have much less incidence of the blood clots in the patients. And usually blood clots happen in patients with high number of PNH cells, when PNH clone exceeds 50% or more.
Thank you for that. You mentioned about the current treatments helping to reduce the likelihood of PNH patients developing blood clots. Is there anything else PNH patients can do to reduce their risk of developing blood clots?
Yeah, I think the successful treatment and to start the therapy and be compliant with therapy is very, very important. Again, the novel treatments that's available not only reduce the symptoms and hemolysis, but they prevent life-threatening complications, including blood clot formation.
Thank you. Is there anything else PNH patients should know about blood clots?
So I think we probably can talk about inhibitors first. So the PNH therapy with complement inhibitors now available, such as eculizumab or Soliris or ravulizumab or ultomiris, was shown that led to significantly reduced incidence of the blood clots. The most recently approved C3 inhibitor, pegcetacoplan or Empaveli, also reduced the incidence of the blood clot, which is a very good thing. Blood thinners very often used in different group of patients, not PNH patients, for prevention of the blood clots. But in PNH patients, the blood thinners for prevention of the blood clots not very often used because their risks exceed their benefits. However, in the patients with PNH, in the situation when the risk of the blood clots are pretty high, such as during the surgeries, prolonged immobilization, and when PNH clone is quite high, blood thinners can be considered for short term to prevent blood clot formation. If blood clots already happened, and unfortunately, despite the use of the treatments, then the blood thinners, such as warfarin or Coumadin, which is preferred drug for treatment of the blood clots. Lovenox injections, or low molecular weight heparin, can be also indicated. And typically, the treatment lasts for 3 to 6 months to get rid of the blood clots. There are some oral formulation, oral blood thinners, such as apixaban or Eliquis, dabigatran or Pradaxa, or rivaroxaban or Xarelta. They can be also effective in treatment of the blood clots in patients with PNH, but still we don't have enough data, and these drugs are not approved for PNH-related thrombosis. So the patients who, when they develop, if they're well controlled on oral complement inhibitor, and it appears to be safe to discontinue blood thinner after treatment for 3 to 6 months if blood clot disappears. However, some patients who develop the blood clots while being on complement inhibitor, usually we recommend to continue a blood thinner indefinitely because the risk of recurrent thrombosis is very, very high. In patients with recurrent blood clots, they require blood thinners indefinitely. And I just want to emphasize in terms of that abnormal blood clotting has been recognized one of the leading causes of death in patients with PNH. So it's very important to be aware of those and prevent their formation as much as possible. And so prevention and effective early treatment of thrombosis is very, very important. And currently approved therapies and several investigational therapies that will be approved in the future show that effectively prevent development of these life-threatening conditions.
Well, thank you so much, Dr. Norkin, for sharing your time and your expertise with all of us today. And if you'd like to find out more about PNH or any other bone marrow failure disease, you can find information on our website at aamds.org. You can also follow us on our social media, Facebook, Instagram, or Twitter. And you can also give us a call on our helpline at 800-747-2820. This concludes our podcast. Thank you, Dr. Norkin.
Thank you.